Zimbabwe's response to the COVID-19 outbreak. Cabinet received an update on the country's response to the COVID-19 outbreak, and this was presented by the Minister of Defense and War Veterans Affairs, Honorable OCZ Mchinguri Kashiri, as the chairperson of the ad hoc interministerial task force on COVID-19. As of 27th September 2021, which is yesterday, Zimbabwe's cumulative COVID-19 cases stood at 129,919, with 122,446 recoveries and 4,607 deaths. The recovery rate stood at 94%, with 99% of cases being attributable to local transmission. We still have active cases, which is standing at 2,772. This week, the number of cases recorded went up to 3,356. The cases increased slightly, with 1,687 cases recorded during the week under consideration, compared to 1,669, which was recorded last week. The following areas recorded the most significant numbers of new cases: Masvingo with 450 cases, Mashonaland East Province 261, Matabeleland North 216, Manicaland 193, Midlands 190, and Mashonaland Central 145. It is apparent that Mashonaland East, Midlands, Masvingo, and Matabeleland South provinces are experiencing a resurgence of COVID-19 spurred by the cases in boarding schools. The majority of the cases were mild and asymptomatic without the need for hospitalization, and they are being managed by the Ministry of Health and Child Care in those schools. The Ministry of Health and Child Care and Primary and Secondary Education, they continue to implement the standard guidelines for the coordinated prevention and management of COVID-19 at all learning institutions, while strengthening measures to ensure continuous teaching and learning during isolation or quarantine. The nation is informed that Cabinet directed that half-term breaks be prohibited in order to help learners catch up on time already lost during the lockdown, and this will also strengthen COVID-19 containment measures. On budget commitments, the Ministry of Health and Child Care cleared arrears amounting to 39 million, which were owed to local authorities. Concerning food and water sustainability, 4 new boreholes were drilled during the week, while 77 others were rehabilitated and 84 hand washing facilities were commissioned at various public places. Harare Metropolitan's water production is averaging 400 megalitres per day against demand of 1,200 megalitres, while Bulawayo's city's water production remains at 153 megalitres against a demand of 155. Government is implementing measures to mitigate the acute water shortages, especially in Harare. Cabinet is pleased to advise that the number of people in need of hospitalization due to COVID-19 continues to decline, bearing testimony to the effectiveness of COVID-19 containment measures in place put by government. Meanwhile, government is looking into sustainable ways of improving the conditions of service for nurses, doctors, and other health professionals. This is in light of the huge workload the professionals are burdened with in this era of the COVID-19 pandemic. Then we move on to the progress report on the procurement and rollout of COVID-19 vaccines. The Vice President and Minister of Health and Child Care, Honorable CGDN Chiwenga, gave an update on the progress made in the procurement and rollout of COVID-19 vaccines. Cabinet advises the nation that as of 27th September 2021, which is yesterday, a total of 3,051,371 people had received their first dose of the COVID-19 vaccine, and 2,211,880,000 their second dose across the country. This translates to a national coverage of 35.7% for the first dose and 25.8% for the second dose. Of special note, is that the country achieved the 3 million vaccination milestone for the first dose on the 23rd September 2021. Cabinet wishes to further inform citizens that China made yet another donation of 500,000 doses of Sinovac vaccines, and these were received on 26th September 2021. The total number of vaccine doses sourced by government since rollout of the vaccination program is 12,300,000, the bulk of which was procured through the Treasury. Then we move on to the update on the transfer of nurses' salaries from Harare and Chitungwiza municipalities' payrolls to the government's payroll. Cabinet received an update on the transfer of nurses' salaries from Harare and Chitungwiza municipalities' payrolls to the government payroll, and this report was presented by Minister of Public Service, Labour and Social Welfare, Honorable Professor P. Mavima, as the chairperson of the ad hoc interministerial committee. Cabinet wishes to inform the public that its decision to transfer health workers from the Chitungwiza and Harare municipalities' payrolls to the government's payroll has started in earnest, with 60 out of the 65 nursing staff in Chitungwiza having been transferred. Measures are being put in place for the city of Harare to expedite the implementation of the cabinet decision of transferring 368 health professionals. This is in line with the government's decision to centralize the payment of essential services. To smoothen implementation of the transfer of the health workers, Cabinet resolved that going forward, this will be done. 1, the implementation of the Cabinet Directive be made in a manner that allows the complete absorption of health professionals from all urban local authorities, starting with Chitungwiza, followed by Harare, and then move on to the remaining local authorities. 2, that the committee be given a month to engage municipalities in order to deal with legacy issues such as outstanding salaries, provident funds, statutory obligations, and other conditions of service such as funeral assistance, medical insurance, and accommodation. Then 3, that instead of transferring just nurses, government will transfer all health workers in urban local authorities to the government payroll under the Ministry of Health and Child Care. Then Cabinet received a report on the Labour Amendment Bill 2021. Cabinet considered and approved the Labour Amendment Bill, which was presented by the Attorney General on behalf of the Chairman of the Cabinet Committee on Legislation. The bill aligns the Labour Amendment Act to Section 65 of the Constitution of Zimbabwe, Amendment Number 20, Act 2013, and to the ratified International Labour Organization ILO conventions. The bill also provides the rights to fair and safe labour practices and standards. The amendments also makes provision for the promotion of the ease of doing business in the labour market through the streamlining of the labour dispute settlements and retrenchment processes. The bill also takes care of emerging issues in the world of work such as labour broking, violence and harassment at the workplace, and emerging forms of employment relationships with a view to closing the lacuna in the existing legislation, thus entrenching fair labour standards contemplated in Section 65 of the Constitution. Provisions are also made to deal with gender-based violence and other cases of violence and harassment at the workplace. Clause 3 outlines the types of work which shall not be defined as forced labor. These include the following: any work or service exacted by virtue of compulsory military service laws, any work or service which forms part of the normal civic obligations voluntarily undertaken by citizens, any work or service exacted from any person as a consequence of a conviction in a court of law, and any work or service exacted by a public authority by virtue of any law in cases of emergency. Then Clause 11 seeks to amend Section 18 to align the Labour Act to Section 65(7) of the Constitution to ensure that women employees have the right to fully paid maternity leave for a period of 3 months by removing qualifying periods, prescribed intervals for maternity, and a number of times for enjoying that right to maternity leave under one employer. The bill will go a long way in maintaining balance between guaranteeing employee rights and ensuring productivity in the workplace. The issue of dysfunctional and fragmentation in the various economic sectors vis-à-vis the rights to freedom of association will also be provided for. That is the Labour Bill. Then we'll move on to mid-year performance review of the National Development Strategy, NDS-1, 2021 to 2025. Cabinet received and adopted the mid-year performance review of the National Development Strategy 1, 2021-2025, and this was presented by the Minister of Finance and Economic Development, Honorable Professor Mutuli Ngube. The mid-year report is the second report after the first quarter report, which was presented in May 2021. This report covers the 14 national priority areas of the National Development Strategy 1 and is a critical component of the strategy's monitoring and evaluation framework. Cabinet wishes to advise the nation that in spite of the challenges posed by COVID-19 pandemic, national economic performance is expected to remain strong on the backdrop of an improved 2020-2021 agricultural season, higher international mineral commodity prices, and a stable macroeconomic environment, and a proactive COVID-19 pandemic national interventions. Projections are therefore that if the current growth trajectory is sustained, there is a high probability that the respective ministries, departments and agencies, MDAs and NDS-1 thematic working groups will be able to meet their national targets for 2021. A synopsis of the performance review indicates that under the economic growth and stability pillar, the GDP growth rate for 2021 has been revised upwards from the initial projection of 7.4% to 7.8%. Budget surpluses were recorded in both the first and second quarters, with revenue performance above targets, while expenditure slightly exceeded the projected target. The declining trend in inflation was also sustained during the second quarter, with quarterly inflation averaging 149% against the targeted 228%. Other highlights include the following. In the moving the economy up the value chain and structural transformation focus area, an increase of capacity utilization went up from 47% in 2020 to 56%. Then under the infrastructure and utilities pillar, remarkable progress was registered in road infrastructure rehabilitation under the Emergency Road Rehabilitation Program 2, ERRP2. Then under image building, international engagement and re-engagement pillar, 2 community radio stations were operationalized. 76% national radio coverage was achieved, and all the targeted awareness campaigns were aired on the major platforms. Under the Human Capital Development and Innovation pillar, 8 innovation hubs, 1 science park, and 4 industrial parks were established during the first half of 2021, with the Verify Engineering Medical Oxygen and Nitrogen Gases plant in Mutare having been completed and commissioned. And under the Health and Well-being focus area, the National Vaccination Program was successfully rolled out, while the Radiotherapy Center at Mpilo Hospital was resuscitated, and the Solar for Health programs to benefit 70 clinics in line with government's drive towards adoption of clean energy was also undertaken. Meanwhile, in the Youth, Sports, Arts and Culture pillar, industrial incubation hubs, interact and cultural heritage centers were established in order to increase youth participation in developmental activities in the country's various socio-economic sectors. The following sporting infrastructure facilities were constructed during the first half of 2021. Wedza Country Club, Victoria Falls, multi-purpose court, Cha-Cha-Cha, multi-purpose court, Rafemoyo, multi-purpose court, concession recreational park. This is across the country. Facilities such as the National Sports Stadium in Harare have been refurbished ahead of the resumption of domestic and international events, and a lot of work has been done. They will soon complete all the refurbishments. In the governance focus area, regional offices and magistrates courts were constructed in Mount Daru, in Chinhoyi, in Lupane, Epworth, and Chiredzi, while 149 statutes have been aligned to the constitutions, leaving a balance of 34. There has been considerable progress in the implementation of the NDS-1 in the remaining pillars, namely the environmental protection, climate resilience and natural resources management, social protection, and devolution and decentralization pillars. Government will not leave anyone behind in the implementation of NDS-1. Then Cabinet received reports on the 800-day cycle of the Second Republic. Cabinet received reports on the 800-day cycle of the Second Republic, and these were presented by the Vice President as Minister of Health and Child Care, the Minister of Higher and Tertiary Education, Innovation, Science and Technology Development, Professor Murwira, and the Minister of Home Affairs, Honorable Kazembe. Under the Ministry of Health and Child Care, Honorable Vice President CGDN Chiwenga reported that construction of the Stone Ridge Polyclinic in Harare South is 80% complete. The targeted drilling of 100 boreholes and installation of 150 solar power systems at primary care clinics are on course to completion. The upgrading of human health laboratories to the required World Health Organization WHO standards at Parenyatwa Hospital, Salimu Gabe Hospital, and Beatrice Infectious Diseases Hospital, and the National Microbiology Reference Laboratory are all above 90% complete. The Minister of Higher and Tertiary Education, Innovation, Science and Technology Development, Honorable Professor Emon Murwira, highlighted that the Mapura beneficiation and value addition plant at Rutenga in the Mwenezi district of Mashungo province was fully assembled and is ready for commissioning, with the prototype Mapura wine having been produced. Buildings under the Higher and Tertiary Education Institutions Civil and Construction Engineering Infrastructure Program are all at various levels of completion as follows. Construction of Bindura University Female Hostel is at 75%. Then the Simon Mazoroze School of Health building is at 70%. The J.M. Gomo Polytechnic Home Economics building is 75%. Then the commercial herringbone 24-point milking equipment was procured, delivered and assembled at the Chinhoyi University of Technology Industrial Park and now awaits commissioning. The Minister of Home Affairs and Cultural Heritage, Honorable Kazembe, reported that most of the materials and services for the redevelopment of the old Bulawayo National Monument has been procured, and the targeted framing of the Beehive Hut in Gugwana was completed. Meanwhile, construction of Weza District Registry building is 70% complete, and the targeted electrical fittings and civil work. The proposed act will promote, preserve, and develop the languages of Zimbabweans. Given the diversity of languages in the country, the act will ensure that their use in order to avoid marginalization of any languages or community from loss of identity and culture. In more detail, the principles will underpin the proposed languages bill, including the following. 1. Promotion of multilingualism and linguistic diversity. 2. Respect of language rights and or linguistic preference is fundamental to the process of nationalism. 3. Development of augmentative and alternative communication systems for people with impediments that inhibit communication. Then 4, recognition and promotion of languages as cultural wealth. 5, establishment and maintenance of institutional structures such as National Languages Board, the National Languages Fund, and the Languages Database. And finally 6, equitable allocation of resources for the development of officially recognized languages. Then Cabinet received a report on the rollout of the National Fuel Management System. The Minister of Higher and Tertiary Education, Innovation, Science and Technology Development, Honorable Professor Murwira, updated on the National Fuel Management System, which was developed by the Harare Institute of Technology, HIT, with support from the Zimbabwe Energy Regulatory Authority, ZERA. The nation will recall that Cabinet earlier on resolved that a technology-based fuel management system which provides real-time fuel tracking capability should be developed and implemented throughout the country. These followed rampant malpractices in the fuel sector which were negatively impacting the wider economy. The objectives of the system are as follows. 1, to improve the quality of fuel service delivery. 2, to reduce the amount of foreign currency required to import fuel. 3, to reduce pilferage of fuel purchased using local currency and ending up selling it on the US dollar denominated market. And then 4, to establish the actual national fuel requirements per province. And 5, to regulate fuel importations which use foreign currency obtained from the foreign currency auction market. Government is pleased to inform the public that this pilot phase of the national fuel management has been completed and the system has been proved to be robust and ready for full implementation. The system, which is set to be rolled out soon across the fuel distribution value chain, including at retail outlets, will ensure judicious management of fuel resources in the country and provide real-time information for decision making. I thank you. This brings us to the end of today's post briefing.
Thank you very much, Honorable Minister, for such a detailed and really inspiring presentation of the post-cabinet committee.
Thank you.
Thank you, members of the media. Until we meet again.
Thank you, guys. Thank you.